Welcome back to The Loop. We're a bold and fresh look at our lives in Kenya here today. And happy 2021 to you. And of course, one of the biggest issues that is being discussed globally is the issue of the COVID-19 vaccine. And our health ministry has ordered 24 million doses of the COVID-19 vaccine, which will be in the country shortly. And of course, the question we're asking you is, are you going to take the vaccine once it becomes available? Will you take the COVID-19 vaccine once it becomes available in Kenya? In a few days, you'll be able to do that. But we also want to hear from you. You can talk to us using the hashtag TheLoopK24. And of course, the WhatsApp number is on the screen right now. Let me just sample some responses here. And Lotan says, Bro Rosafi, no, I feel it's too rushed, too little info on the content. What are the side effects? Lorinda Evelyn says, no, unless it's a requirement while traveling. Can you recall the kids in Western Kenya who became handicapped because of a vaccine? Until now, they're still fighting to get their compensation. So once again, the question is, once the vaccine becomes available in Kenya, will you take the COVID-19 vaccine?
And before we even get to more responses, I'd like to hear first-hand experience from a nurse who's been a friend of mine for years. His name is Jamil. He's 46. He has a degree in nursing, and he's worked in healthcare for years. And he got his vaccine this week. So let's hear from Jamil, who's all the way in California, and we were able to reach him.
This last part is just me speculating, but what I was saying is that since, COVID is obviously a coronavirus, SARS, MERS, the flu, lots of common colds, they're all like coronaviruses. And with all the global research and rapid gene typing of these different viruses or serotypes or whatever you want to call them, to be more specific, I think that there is some possible hope in the future that we get better at treating coronaviruses in general, which means we would get better at treating the flu and the common cold, which means if you want to be the most positive you can be about 2020, that might be your silver lining. We get better at treating different diseases that are based on coronaviruses. I got the Pfizer vaccine today. Today is the 7th of January, 2021, and I'll say I got it around 8 a.m. The only thing I feel right now is anytime you get a shot in your arm, you might feel a little prick, a little numbness after a while, but nothing big. Feels like any other shot I've ever gotten. Nothing crazy. So as I said earlier, I got my vaccine today, which is the first month of the year, 7th day of that month, and then I'll get my next dose on the 29th day, so 22 days apart, so like 3 weeks. So I know a group of people who got the vaccine. Here where I'm at, basically, if you work in a really big hospital, high acuity, big trauma center, you'll tend to get those vaccines first. Whereas I'm long-term care, which means basically if you had to pick 1 or 1A, I'm 1A versus 1. Which means, like, I know a lot of people that I know got their vaccines either a week ago or 2 weeks ago, whereas I'm getting mine now. Which isn't far, but still long enough of a difference, whereas I felt some kind of way that I didn't have my vaccine yet. Just in the first group of people to get it, and I've not seen anybody fall over dead, so I'm feeling pretty confident, and I've had it for about roughly 45 minutes to an hour now, and once again, I don't even feel any residual pain.
That was fascinating.
Okay, so there he is, saying that he's 45 minutes into taking the vaccine. And I guess we need to give him like a week or so to find out, like if there's going to be any residual effects from that.
But he also said that his colleagues have been getting the vaccine over the last 2-3 weeks, and he's like, nobody has killed over dead. So he's saying he's feeling confident.
Yeah, well, yes. So I know we'll wait and see. But of course, the question we're asking today is, if once the COVID-19 vaccine becomes available in Kenya, because it will be, and the Health Ministry has ordered 24 million doses of the vaccine. Will you take it? Will you take the COVID-19 vaccine once it becomes available in Kenya? We'll be sampling your responses and your thoughts and concerns. Of course, use the WhatsApp number on the screen, and you can talk to us using the hashtag LoopK24.
Dr. Andrew Awar, welcome back.
Thank you.
You're becoming our resident doctor. We love you.
It's COVID time.
And Happy New Year.
Thank you. Happy New Year to you too.
So a lot of Kenyans are nervous, and rightfully so. We've seen Corona, started late 2019. The first case in Africa was February, and now here we are, January 2021, and we're being told the vaccine is coming. The quickest vaccine in history developed was the mumps one, and it took 4 years. Why was this one so quick? Was it tested correctly? Yes.
No, there's lots of research that has been going on in the background. And as our colleague in the US mentioned, there are lots of coronaviruses. There was the SARS epidemic in the early 2000s. There was a MERS in the early, I think, 2011, 2012 in the Middle East. And researchers were busy developing vaccines for these coronaviruses. So this time round, it being another coronavirus, it found some work already in progress.
So for decades, this was already happening?
This was already happening for coronaviruses.
Okay.
With the SARS and the MERS. There was a lot of work going on in the MERS. So yes, SARS-CoV-2 is a bit different, but the work was already in progress.
Okay.
Of how to develop a vaccine. Now, development of vaccines has been going on for hundreds of years. This is not the first vaccine that is being made. There are newer techniques now to actually develop a vaccine. We are now going to the genetic level. The vaccine that he got in California basically is developed through these newer genetic ways, actually getting the gene of the virus, manipulating it, introducing it to a human, mimics an infection, and the body just develops immunity.
So one of the concerns that people would be, and myself as well, is looking at the fact that none of us seem to be very clear about what the side effects of this thing are. And Kenya has a very uneasy history with vaccines. You remember the tetanus one, there was the polio vaccines that were there, the church was up in arms. People were like, this is a secret way of sterilizing people because of a global agenda of population control starting in Africa.
And even historically, black bodies, which is what I was asking Jamil, we've been used for testing. Even at the beginning of last year, there was something coming up like, oh, we'll test in Africa. And KOT was up in arms like, Apana, don't come here.
Yeah, test there first and then come
Yes.
I mean, there's always a group of people who would probably be conspiracy theorists, the so-called anti-vaxxers, people who have developed all sorts of conspiracy theories. But I'm yet to see a single Kenyan who doesn't have a mark on their left arm. This is a vaccine. So I guess if your parents were the ones to decide, most of Kenyans would get vaccinated. But since now we are grown-ups and we can decide on our own, there are all sorts of theories that will come in. Majority of the vaccines are actually safe. Vaccines are safe. With regards to viral infections, the best way of fighting viral infections has been through vaccines. There's no effective drug for COVID. Okay? If I asked you, is there an effective drug for measles? No. That's why we get vaccinated. Is there an effective drug for polio? No. That's why we get vaccinated. Smallpox was there before it was a scourge. It was eradicated via vaccination. The only way for us to win against viruses, especially of this nature, is vaccines.
Let me ask you, so for somebody who's been exposed to coronavirus and you've built antibodies, do I need the vaccine?
So that's an important question. Now the challenge is we do not know how long the antibodies last. Okay, even with a vaccine, we still do not know, will you need to be vaccinated every year? For example, for flu,
yes, the flu vaccine you take every year.
I recommend my patients to be vaccinated every year. We do not know for the new COVID vaccines what their schedule will be like, but some of the manufacturers have actually said it could be lifelong. Okay, just like, or it could be for an extended period of time compared to what we are seeing. There is also some recent research that has actually shown that for people who have been already exposed to COVID and have had COVID, they actually develop some level of immunity. It tends to wane off over time, but there are what we call non-specific parts of the immune system which will kick in case the person is exposed again to the virus. That does not mean you may not get, but usually, hopefully, it may be less severe in the subsequent infection.
So let me ask you, in the process of vaccinating people, will we then need to be tested for COVID in order to then get the vaccine?
I doubt that will happen. So if you look at the vaccination for COVID, actually, there are categories of people to be vaccinated. We are not all going to be vaccinated at the same time. We're almost 8 billion in the world. At best, all those manufacturers will probably make maybe 1 billion doses in a year. So if you have to vaccinate everyone, it's going to take time. If you said everybody needs to be vaccinated, it's going to take time. So the vaccines would start actually the high-risk groups. And even the 24 million that has been ordered by our Ministry of Health would first go, for example, to frontline healthcare workers.
So Kina, you guys?
Yes, would be first because I see COVID patients every day. It's my business.
Okay.
So those would be the first people. Second people would be the elderly, so persons above the age of 65. Thirdly would probably be persons living with conditions that make them susceptible to severe COVID. You get me? So
I saw some debate on that, Dr. where someone was saying instead of aiming for the elderly, maybe the next in line after frontline workers, the medical community, it should be the working community. Like the global economy is almost on its, well, I don't want to say it's on its knees, but we've all suffered for that. So would you advocate for going for the elderly and vulnerable people, or should it be the workforce, like our teachers?
So if you look at it in terms of effect of the disease, so unfortunately for persons above the age of 55, okay, COVID is a nasty disease. They actually have a high risk of losing their lives. And for every decade after that, the risk goes up by about 15 to 20%.
Wow.
So that, you know, if you're 80 years old, you have an 8 in 10 chance of actually succumbing to the illness. So because of that, and this one we see it across board, even with the other infections. As you grow older, if you do not develop one of these chronic illnesses, an infection is probably the thing that will be the greatest risk to your life. If you're 75 years old, you don't have cancer, you're not diabetic, you're not hypertensive. An infection is actually the thing that poses the greatest risk to your life. And that's why for persons above the age of 65, we recommend that they get a flu vaccine every year. They get a pneumonia vaccine once they turn 65. Simply because as you grow older, also your immunity tends to wane. And that's why perhaps, as is mentioned, healthcare workers, persons working in long-term care facilities, working with these elderly, frail people, because they're the ones, if they get, they die. The young people, they have COVID, they don't even know they have COVID.
But the young people are the ones who are spreading it.
Well, walking it around and spreading it.
Yeah.
That's where they'll be last.
Dr. There's something you said, there's something you said on the phone yesterday when we were talking. You called COVID men's flu because men are getting it and succumbing to it at higher rates than women. So we see in Kenya especially, women, babies, we are in front of the doctor way more than men and older children, teenagers, young adults. How would you suggest that they be reached by the vaccine?
So I think for men, it would be interesting to see how we are going to set this up, because in the national program, most of the vaccination is actually for children. We don't have an active adult vaccination program. And so for some of the wealthier countries, they actually do have, especially for the elderly. So the elderly get the vaccines usually out of free of cost. The rest probably will have to pay some little fee to get the vaccine. For example, if you want to get a flu vaccine here in Kenya, you'll have to pay for it from your pocket. Now, the people who are most vulnerable are the elderly, and you need to protect them because all of us are headed that way anyway. And with regards to what she's mentioned about vaccination, it's planning of the vaccination is also very important. There's a lot of work that needs to be taken. People think 24 million vaccines will arrive and everybody will be vaccinated. There's cold chain that needs to be maintained, because if you don't maintain those vaccines at specific temperatures,
yes,
the efficacy goes down. Then there's distribution.
Where are the vaccines going to go? Will they come to KEMSA, or where will they be? Because I mean, last year you saw COVID-19 millionaires became the thing. So what would be the the process
okay.
of receiving the vaccines? Where do they go? How do they get to the hospitals?
I may not be the best person to discuss that in terms of where do they go, but
ideally,
my presumption would be to follow the usual chain for the rest of the vaccines that we tend to have, and that's why Kenya has actually chosen the Oxford AstraZeneca vaccine, simply because it will be almost like the other vaccines that we have, maintained between 2 to 8 degrees of Celsius, compared to the Pfizer and Moderna vaccine, which require -20, -70.
So they need to be frozen, basically.
Yeah, they need to be frozen. So that infrastructure we may not have in place currently, and that's probably why we've gone for a vaccine that, yes, a little bit lower in terms of efficacy, but at least this is something you'll be able to manage. You don't need to start putting up, cold rooms and things like that. In Germany, they have trucks that actually have nitrogen to actually make sure that those vaccines are frozen.
So for me, one of the things that I'm very suspicious about things that happen.
I don't think you want this vaccine, Mike. Let me just call you up.
No. I'm just voicing what the ordinary Kenyan would be thinking. I'm very suspicious. How will I know I'm not being injected with water? Or how am I able to tell as an ordinary mwananchi that, okay, anyway, this is the real vaccine nimepewa?
So one of the things is we have to, as Kenyans, we need to develop trust in our government, trust in the Ministry of Health, trust in the healthcare workers, because we are out here working for the best interests of Kenyans. The government is actually making the efforts to actually take care of its populace, because without its populace, the government does not exist. So there's been a lot of backlash, okay, and mistrust of, what the intentions of the government are noble. I mean, I am happy that, we are having this discussion this early in the year about vaccines coming. I anticipated that probably vaccines would come much later, simply because if you look at even the orders, I mean, the US ordered for close to 300 million doses. Okay, they were the first ones. Any company that was going to get approval first, the Americans are giving you 1.2 billion. Okay, and where does Kenya, fit in that? I mean, how do we muscle in to get a vaccine? I mean, the wealthier countries would gobble the vaccine, and the rest of us would have to wait until they are done, and then the rest of us get the vaccine.
I actually think it's impressive.
But
I actually think. Okay, go on.
There's an alliance called the Global Vaccine Alliance Group, and this actually is trying to negotiate for low to middle income countries to actually be able to access, because they've grouped up almost 80 countries to actually negotiate to get a vaccine. Others would have to wait until the big boys get a vaccine first.
That's true.
And then it comes to the rest
and then
of us.
we'd see that again, that class divide between the global north and the global south, and then some people are just not, they go back to life as normal, the post-COVID that we've been saying, nitakuona after corona, meanwhile we're still waiting. I'm actually impressed. I think Kenya is number 2 in Africa to be ordering. South Africa are getting their doses in January, and I think
Egypt already ordered.
Oh, they already did. Okay.
I think they negotiated with the Chinese. The Chinese also have a vaccine. They actually have 2 vaccines.
Where doesn't Kenya have one?
Good question.
Good question. I'm too busy seeing COVID patients.
Okay. I think let's take some feedback. Of course, remember the question we're asking you is, will you take the COVID-19 vaccine once it becomes available in Kenya? Once again, will you take the COVID-19 vaccine once it becomes available in Kenya? The WhatsApp number is on the screen, and you can talk to us also using the hashtag #TheLoopK24. All right, here we go. Yes, COVID-19 vaccine, unless it's approved by WHO, otherwise the Mwananchi lives only with the mercies of the Almighty God. Note, I wish to advise the striking doctors to empathize with poor patients and go back to work as the union renegotiates with the employer. All right, that's Catechist Wilson Ngetich. Thank you so much for that. Yes, it's better to get the vaccination. Last year has been a year of worries for the weird situation caused by corona. Deaths all over, in fact. For that advantage to have the vaccine, one should thank God. That's Chris Kamau at Githurai. Thank you so much for your thoughts, Chris.
Okay. I think from the information already, I can't see. Our people through social media, most wouldn't be willing to take it. But then hopefully our medical experts can help us to get informed about that, which is exactly why you are here, Doctor.
All right. So, of course, the question, remember, we're asking you is, will you take the COVID-19 vaccine once it becomes available in Kenya. And Julius Joseph says, for me, I won't take it. I actually need to know the side effects first. And he's talking to us from Dandora. Whatever it is that you are, remember, you can also chip in your 2 cents around this conversation. Will you take the COVID-19 vaccine once it becomes available in Kenya? We have to take a short break, but when we come back, more with the good doctor here, and definitely want to hear your thoughts and opinions.